Order. The member for Melton.
Thank you, Acting Speaker. I rise today to speak on the Health Legislation Amendment and Repeal Bill. This bill seeks to continue the work of the Andrews Labor government's commitment to Victorians' health and wellbeing. We all know that it's this government that leads the way in ensuring all Victorians have access to quality health care and are also protected from adverse health outcomes that some in the business community wish to expose Victorians to in order to create a profit. We all well know that for many years Big Tobacco have been targeting communities for profit in full knowledge that the products that they sell are both dangerous and addictive. We have seen that they will stop at nothing to ensure they influence new consumers from taking up their dangerous and addictive products. In the past, advertising to younger demographics has been their business model to ensure more and more profit are delivered to their shareholders at the expense of the health and wellbeing of their consumers. It is governments and affected family that are left to pick up the pieces when the damage they create start altering the health of their consumers with devastating consequences. Smoking costs the Victorian economy $3.8 billion for healthcare and $5.8 billion in intangible costs associated with the loss of life every year. The emotional trauma from losing a loved one from something preventable is immeasurable. We also know that through the efforts of Victoria and the Commonwealth governments that regulation and restriction of Big Tobacco and their business model has seen a reduction in rates of smoking and the community's attitude to tobacco use. In particular, amazing work has been achieved in reducing the prevalence of smoking in young people who Big Tobacco would often target as part of their business model. This has thankfully had devastating consequences on Big Tobacco companies' profit. Recently, we have seen these large companies change their focus by moving from traditional tobacco to new smoke-free products, commonly known as e-cigarettes. These new campaigns are part of the industry's strategy to promote themselves as part of a solution to tobacco-related harm that they themselves created. But let's be clear, these campaigns support the profits and interests of the tobacco industry and about making themselves relevant to new consumers again. This isn't about reducing tobacco harm, it's about replacing their consumers' loss through legitimate tobacco harm reduction or through the deadly consequences of their products. We know that banning advertising of tobacco has helped reduce the uptake of new smokers. The purpose that Big Tobacco companies advertise, as any business would, is to create new customers. That's why they did it, and that's why they fought so hard against banning it, because banning tobacco advertising would reduce new customers. Big Tobacco has looked for every loophole and pushed every line. Recently, we've seen these tobacco companies try to promote their products with international motorsport. They've been developing new forms of indirect advertising designed to circumvent existing laws that prevent the promotion of tobacco and e-cigarette products. This new marketing does not directly promote the brand name of a tobacco or e-cigarette product. There is a question that if these tactics are considered advertising under Victorian legislation, although clearly that it is what they are. This is clear and calculated strategy to reintroduce tobacco advertising and sponsorship into motorsport and public events more widely. To strengthen existing tobacco advertising restrictions, some changes to the Tobacco Act 1987 will occur. The definition of a tobacco or e-cigarette advertisement will be extended to include words and designs that are closely associated with the manufacturer of tobacco or e-cigarette product. Victoria will be the first jurisdiction to make legislative amendments to clarify this kind of indirect marketing techniques are actually tobacco advertisements and should be prohibited. The Commonwealth legislation doesn't extend to e-cigarettes and so can't prohibit e-cigarette advertisements. E-cigarettes or vaping have been available for some time now and has of course been promoted as harm reduction. However, I think it's important to clarify a few points that are often overlooked when it comes to vaping and e-cigarettes. The Australian Secondary Schools Alcohol and Drug Survey found that e-cigarette usage among students aged 12 to 17 years increased from 3% in 2014 to 4% in 2017. Other studies from the US, Canada and the UK show an association between e-cigarette use in non-smokers and them taking up cigarette smoking in the future. This suggests there may be a gateway effect between e-cigarettes towards traditional cigarettes. We have a responsibility to ensure smoking behaviours and nicotine addiction isn't as much of a problem for younger people as it has been previously before tobacco harm reduction methods were introduced. This is particularly concerning with the well-documented cases coming from the US of increasing addiction to nicotine e-cigarettes amongst young people. Findings from the US have shown e-cigarette use amongst US high school students increased from 11.7% in 2017 to 20.8% in 2018. And until recently, smoking had been seen as an unattractive for teenagers and for young people. However, the increasing use of electronic cigarettes or e-cigarettes and vaping is clearly gaining popularity. The effects on health is inconclusive, as this is still a fairly new phenomenon. What isn't inconclusive is the knowledge that big tobacco don't care what damage their products do in order to give their shareholders greater and greater profit, regardless of the devastating consequences. In December last year, the US Surgeon General declared that e-cigarette usage among youth in the US was at epidemic levels. The member for Broadmeadows also made reference to additional statements by the US Surgeon General about the dangers from e-cigarettes. Vapour from e-cigarettes may not contain tar and some of the other chemicals found in smokes. However, many often hazardous substances have been found. There seems to be new evidence that e-cigarettes or vaping may have adverse health impacts, such as cardiovascular disease, respiratory disease and cancer. The use of these e-cigarettes, whether they contain nicotine or not, is considered particularly harmful for teenagers and pregnant women. As recently as August, the Centres for Disease Control and Prevention issued a clinical alert following an increase in cases of severe pulmonary disease in several states across the US, which are being linked to the use of e-cigarettes or vaping. The evidence of reducing smoking rates by the use of vaping isn't reflected in statistics. The Victorian Smoking and Health Survey found almost no change in e-cigarette usage among former smokers between 2015 at 5.2% and 2018 at 5.3%. I will acknowledge that many of the rigorous scientific reviews acknowledge that e-cigarettes are likely to be less harmful than cigarettes if an individual were to switch completely to vaping. However, research shows most smokers who use e-cigarettes continue to use traditional smoking. Switching from cigarettes to e-cigarettes is likely to be less harmful. There is accumulating evidence of adverse health impacts from e-cigarette use. The evidence on long-term harms will take years to be collected. The other part of this legislation I wish to address is the repeal of the Access to Medicinal Cannabis Act. The Victorian Access to the Medicinal Cannabis Act was passed when no other jurisdiction had legalised access to medicinal cannabis. Imported cannabis products were prohibited by the Commonwealth and a local Victorian industry didn't exist. We know that the federal government changed their view on medicinal cannabis within a year of the Andrews Labor government's introduction of the Act, once they saw the community expectation that those in need of this medication should have access to medicinal cannabis. The Commonwealth Government now allows high-quality medicinal cannabis products to be imported into Australia and has established a national-wide regulatory system for medicinal cannabis cultivation, manufacture and patient access. With the introduction of the nationwide system, the need for specific Victorian legislation is no longer needed. Now, any patient with any medical condition can be prescribed medicinal cannabis by their doctor if that doctor believes it is an appropriate treatment for their condition. Cost often remains the biggest barrier to access for families needing access to this medication. The cost of medicinal cannabis products can vary substantially from $50 to $1,000 per patient per week. The Andrews Labor government established a compassionate access scheme for children with severe intractable epilepsy. We have and will continue to call on Canberra to speed up the listing of medicinal cannabis products on the PBS scheme to make them affordable for all patients. Medicinal cannabis is not a silver bullet or a wonder drug, but it can be a valuable addition that can be used to treat severe drug-resistant epilepsy in children who have exhausted all other existing options. For many of these kids, this medication has led to a reduction in seizures and made an important difference in their daily lives and in the lives of their families. Because this is a government that went to work from day one, not sitting on their hands for 4 years like those opposite did, Victoria is now emerging as a medicinal cannabis hub. We have a Victorian medicinal cannabis industry development plan. We here in Victoria are favoured by many firms in the cannabis industry. These companies are still establishing their operations, but 3 recent announcements alone forecast the creation of over 750 new jobs, including regional Victoria. I commend this bill to the House and I wish it for a speedy passage.